Greetings, everyone. My name is Stephanie Robles. I'm an undergraduate student at Texas Southern University. Today is May 3rd, 2022, and in today's lecture, we will be going over charged particle therapy, our innovative approach towards beating cancer. Alrighty. Moving on to this first slide here, I will be providing a summary of the main topics I'll be covering in this lecture. We will be going over a brief introduction to charged particle therapy, providing the fundamental information that I believe you should know. I'll be going over the different types of particle therapy treatments that are currently available. And I'll be providing the benefits. So that includes the advantages, the disadvantages, the risks, and the limitations that are presented from the usage of charged particle therapy. Following that, I'll be providing a brief explanation on the process that takes place for a patient undergoing a particle therapy treatment. Specifically, I'll be going over proton radiotherapy. Following that, I'll also provide a current list of the applicable lesions and cancers for a charged particle therapy treatment, for a charged particle therapy patient, And I'll be summing everything up with a conclusion, and following that, I'll just add in a slide. I've added in a slide of references, so the different websites and journals that I've read to obtain this information that I'm sharing today. Alrighty, I'm going to minimize myself so I'm not obstructing the slide. The different charged particle therapy treatments. So charged particle therapy treatments come in the form of two types, light and heavy charged particles. Some examples of light charged particles are electrons and positrons. Positrons themselves are not used in the treatment, but the diagnostic portion. They can be found in PET scans. Electrons are found in the electron beam radiation. This can occur either as a byproduct of something like Compton scattering or pair production, or they can be used directly in an XRT gantry, which is a curative treatment option for a prostate cancer patient. Alrighty, now in regards to heavy charged particles, we have protons and carbons. Proton radiotherapy uses the characteristics of protons to deliver cancer treatment with fewer complications. Next, I talk about carbon. Carbon ion therapy directs charged carbon nuclei at specific tumor types to deposit energy. Carbon ion beams have high linear energy transfers. These high linear energy transfers demonstrate high relative biological effectiveness, which I'll be going over a bit further on in the lecture when I talk about Bragg peaks. All right. So let's discuss the benefits coming from utilizing particle radiotherapy. There's a reduction in the integral dose of a patient of up to a factor of 3. So let me go ahead and simplify that by introducing the topic of entry and exit doses. So here on this side of the screen, you can see that it says standard radiotherapy. So this is your conventional X-ray therapy with photons. And on this side of the screen, you see proton beam therapy. So this is your charged particle therapy. Now you see this green line. This ray represents the photons being administered to a patient with a tumor. And this blue line represents the proton beam ray being administered to a patient with a tumor as well in the same location. So the tumor site is relatively centered, and you see this photon beam entering and exiting. And then you see this proton beam entering and not exiting. You see it stop right here at the tumor site. Now, this is crucial. On this side of the screen where we talk about standard radiotherapy, you see that the photons continue, and standard radiotherapy has an exit dose. So an exit dosage basically exposes all this part of the healthy tissue to radiation, while on this side of the brain of the healthy tissue is preserved. Now, when your treatment beam is administered to the patient, some of the energy actually gets lost while traveling to the tumor site. Now, what this basically means is if you have 100 units of energy administered to the patient, not all 100 units are being administered at the tumor site. Some of it is being lost in the entry of the radiation to the body. Now, this part of the brain, in this specific example, is being exposed to that radiation. The radiation is being deposited at the tumor site, and it's going to continue. So all of this is getting exposed to radiation. While on this side, you have a proton beam therapy, which the proton beam enters. You do have an entry dose a lot less energy is being deposited at this healthy tissue upon entering the body when comparing it to standard radiotherapy. And a lot of that energy that is administered, the vast majority of it is being deposited at this tumor site. So you see that this tissue here is not exposed to that energy, that radiation, I'm sorry. Now, putting these two concepts together, you're going to want to go ahead and come in at different angles and not this same angle every time to target this tumor site. This is why multiple sessions are needed when you're dealing with radiation therapy. You don't want to expose this healthy tissue multiple times and cause this tissue to be exposed to radiation consecutively at every single treatment appointment. So you're going to come in at different angles here. And now, if you come in at this angle, you see that this part of the patient is also getting exposed to radiation. And if you come in here, you see that all of this is getting exposed to radiation as well because of that exit dose. It makes it very complicated to sensitive areas of the body, such as the brain, the lungs, the heart, the prostate, the breast, and others, again, more sensitive areas. While on this side, you're going to go ahead and come in at different angles still, but you don't have that secondary radiation that's going to continue. I'm sorry, not the secondary radiation, the exit dose that's going to continue. You're going to have this part exposed to the radiation, this part exposed to the radiation, but not the part after the tumor site. And that is crucial to increasing the chances of success. So let's visit this again. So like I stated, it's an advantageous treatment. It's an advantageous treatment for high-risk areas of the body. It is also minimal in its side effects when compared to those of the conventional X-ray therapy and conventional X-ray therapy. And this is because a lot less portions of that healthy tissue is being exposed to radiation. So a patient will experience a lot less or a lot minimal side effects because they have less radiation exposure to the healthy portions of their body. And this again is dependent on size, location, and the patient's medical history. Now, this treatment is a non-invasive treatment. It does not pose an obstruction to daily activities. Now, what this means is basically you can go in at your short length session, and it ranges from about 15 to 45 minutes, depending on, again, the size, the location, the facility. And majority of that time is actually spent positioning the patient into its exact location so that that charged particle beam can be administered. Okay, here it says that treatment can be used in combination with other treatments. So this includes things like chemotherapy or any other surgical procedures. You can use combinations of both to increase its effectiveness. All right, so we did discuss these: the entry dose, the exit dose, the entry dose, the no exit dose, and the low energy exposure to the entry and the higher in comparison to a charged particle beam entry dose for the standard radiotherapy. Alrighty, let's go over the limitations of charged particle therapy. Now, charged particle therapy has an increased skin dose that complicates the tumor that's not deep-seated. An example of a deep-seated tumor will be a pelvic region, and this is extremely important because of the concept of the Bragg peak, which I will be going over in a future slide. So I'll talk a little bit more about that. A target alignment is only a partial solution because of the variation in patient anatomy anywhere in the beam path. Now, every single patient is going to vary, even if they have the same cancerous lesion. This is because they vary in height, in size, in weight, in medical history, in degree of the tumor size and things like that. They're going to vary. Therefore, when administering the treatment, no treatment is going to be identical. You can't reuse the treatment. It's a highly specialized treatment. And not only that, but when delivering the patient in the treatment, it's important to note that a patient is going to move slightly because of breathing. So the muscles are going to move and the muscles are going to contract. And this is why it's important to take all of those body movements in account when actually planning their treatment. The majority of the time is actually spent planning the patient's treatment than actually administering the treatment. Now, we move on to state that a high risk for secondary neutrons because of their biological effectiveness. Now, what this means is I'm going to go ahead and pull up this photo once more, and you have proton beam therapy here. So you have your proton beam that is coming inside the patient's body, and then you have your tumor site here. Now, at the tumor site or in the body in general, you have cells. Cells are composed of a nucleus. And in the nucleus, you have protons and you have neutrons. And protons are positively charged while neutrons are neutral. And you have electrons that orbit. You have electrons that orbit the nucleus itself. And when you have protons coming in this therapy treatment, protons are positively charged, and the electrons that are orbiting the nucleus in the body are negatively charged. So that's going to introduce the concept of ionization. Ionization actually changes the characteristics of an atom, which changes the characteristics of the molecule that the atom actually resides in. So because of this concept of ionization, the radiation damages the molecules within the cell, which inside the cell, you can have DNA, and DNA is damaging the DNA destroys the actual specific functions of the cell. So one of the functions of the cell is to divide and proliferate, which that all, bringing on all those concepts together, it basically obstructs the tumor cells to be able to replicate. So when tumor cells replicate, they get bigger and bigger and bigger and bigger. Now, obstructing that functionality allows the tumor to not replicate, to not get bigger, and to break down those cells and to target the actual tumor. Now, that can be really advantageous with our aim, which is to minimize the size of the tumor and obstruct it from growing in size. Now, there's this concept of, there's the risk of secondary neutrons to be scattered from this treatment nozzle. And when secondary neutrons are scattered and enter the body or interact with the body, that can actually stream a risk of secondary cancer. Now, secondary cancer can occur years later after treatment. So it's important to take those risks and those notations and those limitations into account when planning the treatment for a patient, specifically a proton radiotherapy treatment. Alrighty, we're going to go ahead and move on. And okay, so the next risk is the treatment is specialized on a patient-to-patient basis. Like I mentioned before, each patient is highly, highly different. It's going to vary in a lot of different aspects. So this treatment plan is not reusable. It takes a lot of specialty in the medical physicist and the radiation oncologist to construct a highly specific treatment plan per patient. This increases the cost and it limits the number of charged particle therapy facilities. It is a growing field, so there's not as many people specialized in this exact treatment plan as there are in conventional X-ray therapy. Alrighty, let's go on and talk about the proton radiotherapy process in general. So a proton radiotherapy process begins with an initial consultation with the medical team. The medical team includes individuals such as medical physicists and radiation oncologists to plan out and map out the actual treatment plan for the patient. The patient is going to receive an MRI, a PET scan, and or a CT scan to actually map out the tumor in 3 dimensions. It's also important to map out the tumor in 4 dimensions when possible, so you can take into account movement as the patient does normal biological functions such as breathing throughout the treatment. Alrighty, so an immobilizing device is absolutely crucial because you want the patient to stay as still as possible when delivering the treatment. This is because you want the exact, let's go back to this slide here, you want that exact beam of protons to target the exact tumor sites, not here, not here, not here, but deposit all of its energy or as much energy as possible to the actual tumor site and not the healthy tissues in the body. Alrighty, let's go on one more. Now, treatment is carried out in multiple short-length sessions. Each session, like I mentioned before, is about 15 to 45 minutes, depending on the patient and the facility. Majority of that time is spent positioning the patient. So this is why so taking this into account, the desired results are highly dependent on the tumor size and location. There's not a set number of sessions and not a set amount of energy that when you deposit it into at the tumor site, that'll give you the desired results. It's highly dependent on how the patient's body reacts and responds to the treatment being administered. Alrighty, here. Now I introduce this is a picture of a frag peak. Now right here in the dotted lines, you see X-ray therapy. So you see the energy come up, the dose percentage at 100% here, and then do a drop off. And you see it continue. So this right here is actually the exit dose. This is the entry dose. This is actually the exit dose. Now, when you compare that to that of the proton therapy in this example, you see that it flatlines, and it takes a sharp increase, and then it decreases exponentially. You see, the majority of the dosage energy is actually being deposited at the tumor, and it's going to have a rapid drop off. This is because you see there's no exit dose here. The energy stops traveling past the tumor site, and that is extremely crucial, again, for preserving that healthy tissue. It increases that chance of success rate for the patient. Alrighty. So I move on to state the current applicable lesions and cancers. We have ocular melanoma, intracranial tumors, prostate and breast cancers, peripheral lung lesions, head and neck cancers, spinal and brain tumors, cardomas, and chondrosarcomas. And these are all very sensitive areas of the body. And I did state here pediatric cancers. Now, pediatric cancers are included because these patients are in the growing stage of their lives. It is very essential that they preserve and they maintain those essential functions that their body needs to survive as they grow older. So this is why pediatric patients are candidates for a charged particle therapy treatment. All right, now in conclusion, today I've talked about the medical advantages that particle therapy withholds in the field of cancer treatment. I talked about the different limitations that come from the utilization of particle therapy. I also talked about the administration process that patients undergoing a particle radiotherapy treatment would experience, the current applicable lesions of the current applicable cancerous lesions, and the future for charged particle therapy. As of August of 2020, there are currently 89 particle therapy centers worldwide. There's currently 41 and more under construction. So it is a growing field. We are currently researching extensively on it to learn more about the effects, the advantages, disadvantages. So I personally am very excited for that growth. So thank you very much and have a great day.